everyone, in this video today I'm going to be addressing pandas and pans skepticism. Some people are skeptical about the existence of pandas and pans, and this is what I would like to clear up in this video. Number 1. An infection may have triggered it, but now you can treat it just like any sort of OCD or tics or psychiatric symptom or neurological symptom is treated. The answer I would give to that is the OCD in pandas and pans is usually very, very extreme. It's like one day someone may go to bed, they're fine, they're happy, and the next day they have constant intrusive thoughts, distorted thinking patterns, and rituals that take up most of their day. Some people may have Tourette OCD, which is a form where it's more sensation-based and don't respond to CBT or ERP. And for some people with the anxiety form of OCD, it may be so extreme in pandas and pans that these people don't really respond to therapies. And what I mean by that is, if I use the analogy of a flood, you imagine the flood represents the OCD symptoms. CBT is like a bucket trying to scoop it out, but whilst there is still a leak, unfortunately you're not going to get very far. So the leak, which represents the underlying infection and inflammation, once that's addressed with things like antibiotics and anti-inflammatory methods, then, the symptoms may dissipate themselves, and then CBT can be used to address any residual OCD symptoms. Some people find that therapy can help people cope in mild to moderate flares, but some people are just too seriously and severely affected. And also, pandas and pans can cause things such as I said, distorted thinking patterns, memory decline, intense brain fog, and developmental regression. And these things can actually prevent someone from being able to even participate in therapy. So like for me, I was very out of it. It would have been very difficult for me to participate in anything like that. So I think that's something for people to be aware of. And people, if therapy could help people with these conditions, it can help people cope to some extent, but it doesn't cure it, and people should never ever ever be subject to a lifetime of this horror. So something does need to be done about it, and if CBT could help people enough, then great, but that doesn't happen, and that's why people have to sometimes spend thousands and thousands of pounds to sometimes even go abroad and find treatment that works. Somebody wouldn't do that if the therapy could help. But yes, with medications as well, some people find that it helps a bit, but again, it does not address every symptom. There are symptoms such as personality changes, loss of coordination, cognitive decline, oppositional defiance. There are symptoms like that, and sleep disturbance and increase in urinary frequency that the medications do not address. Therefore, someone is still disabled by the condition with like all that and the brain fog and everything. People just need to have the inflammation reduced and need to have support, something to change their immune system to allow people to have a quality of life again. And it's heartbreaking that people don't have the access to this all the time. Medications may also not be effective for some people. There are people with pandas and pans who just do not respond to any of these medications, SSRIs or antipsychotics, and people are left without care, as I said. Some people also have adverse reactions to it. People with pandas and pans can have adverse reactions to SSRIs. I know when I was younger, I'm okay on a low dose, but I once went on a high dose SSRI medication and experienced some irritability and agitation, so that can actually occur in some people, so it's not always an option. But yes, number 2, it's just Tourette's and OCD, accept it. I do hear this quite a lot. People are told to accept it, but when there is a child crying, saying they don't want to live anymore due to this, that's not something that you can accept. When people aren't responding to any of the medications or therapies, that's not something you can accept. When people are told that they may be in and out of psychiatric institutions for their entire life, that's not something you can accept, and something needs to be done. It's incredibly unethical to just tell someone to accept this hell as their life without giving them the appropriate support and measures to find the root and address it. Also, when people say it's just Tourette's and OCD, they're forgetting the other symptoms as well, like the increase in urinary frequency, brain fog, sudden sleep disturbances that can include REM behaviour disorder, psychosis. Like, there's lots of symptoms of PANDAS and PANS that don't actually occur in typical Tourette's and OCD, especially with like the cognitive decline and developmental regression. Although, as I say, there is definitely some overlap with the rages, the OCD, ADHD traits. There is overlap, but again, there are other symptoms. Some people may not even display the other symptoms though, which can make diagnosis quite difficult. But I believe that it is important to rule out PANDAS and PANS so that people can have the best chance of having a better quality of life. A study first published on the 12th of August 2014 and then published in the Journal of Child Neurology in 2015 did PET scans on the brains of people with PANDAS or Tourette syndrome. Neuroinflammation was found in the bilateral caudate and the bilateral lentiform nuclei in the PANDAS group, but only in the bilateral caudate nuclei in the Tourette's group. And this signified a difference between how brains are affected by Tourette syndrome and PANDAS syndrome. In Dr. Susan Swedo's PANDAS and PANS Standards of Care Summit presentation, given in Illinois on October the 4th, 2018, she showed that there are differences in executive functioning in patients with PANDAS and patients with Tourette syndrome. In PANDAS, people had more difficulties with response selection, and in Tourette's, people had more problems with response execution. People with classic OCD and Tourette's don't necessarily respond to antibiotics and may not respond to anti-inflammatory medications. So, you know, that's a difference there. And I think that it's just unethical to not rule these things out and do what you can to give someone a better quality of life. If there's anything that can do to help people, then it needs to be done. Number 3, it's a coincidence that they got better with antibiotics or anti-inflammatories. They were going to get better anyway. This has happened, too many times. So many people in the PANDAS PANS community go on antibiotics and feel better. The amount of times that's happened for people, it's not a coincidence. You can see a direct correlation there. And people also recovering with IVIG and stuff, it's obviously proving that the immune system needs to be targeted. And also, sometimes when anti-inflammatory medication is taken away, symptoms return, and so on. So, you can see the correlation there. Number 4, PANDAS isn't a recognised condition. Actually, it is. PANDAS was discovered by Dr. Susan Swedo at the National Institute of Mental Health. And PANDAS is published as a diagnosis in the International Classification of Diseases 11, which was recently published. It's given the code 8E4A.0. PANDAS and PANS has also been studied by Yale University, Stanford University and Harvard University. Stanford has their own immune behavioural health clinic where they specialise in treating patients with PANS. Number 5, most kids get strep. So of course kids with OCD and tics will get strep as well. The thing is here is it's a direct correlation. People may have an infection that triggers the symptoms, and every time they get ill, they have a sudden onset of severe symptoms again. And in each flare, people can experience symptoms that they haven't had before. And again, that sort of thing doesn't really happen in classic Tourette's. I don't think you get an infection and develop symptoms that you haven't had before that suddenly. So I think that's something that distinguishes things as well. But also, once the infection is addressed, people's neurological and psychiatric symptoms reduce. So that does show a direct correlation. Saying that sort of thing with trying to disprove it by saying that is like saying that people with Sydenham's chorea would get it anyway despite getting strep, when we know that Sydenham's chorea is another form of basal ganglia encephalitis and it is triggered by strep, the same as PANDAS. So people saying that, it doesn't really make sense, because the strep or other infections is the trigger, and there is a correlation proving that when people have the infection, they have neurological and psychiatric symptoms as well. Number 6, it's new. PANDAS is a newly identified condition pretty much. It was identified in 1998 and PANS even more recently because they found that other infections and other agents could trigger the onset of these symptoms as well. But although it's new, something being new doesn't mean it's not real. You know, everything had to be identified at some time, and we are always progressing in medicine. But saying this, there have been accounts of similar symptoms occurring after a strep infection for centuries. In Sir William Osler's book on chorea and choreiform affections in 1894, he said that a frequent complaint from the mother is that the character of her child has completely changed. The following are the most striking of the mental changes. The patient may do odd and meaningless acts, which we now know as obsessive-compulsive disorder, a disturbance in the moral sense, great irritability in temper, with emotional outbreaks, which we would now know as emotional lability, disturbance in the faculty of memory and attention, transient loss of the ability to read and write may occur, and actual melancholia may occur. As I said, this was written in 1894, and it was about patients with Sydenham's chorea, which is another form of basal ganglia encephalitis triggered by strep, just presenting differently to PANDAS. But again, these patients did have symptoms which we would now probably identify as PANDAS. So people have had PANDAS for centuries, it just wasn't identified. Thankfully, now it is identified and research is moving forward, so people are able to get the help that they need without suffering so much. Although I say without, unfortunately, some people find it difficult to access treatment. People find it very difficult to find a doctor who understands. So at the minute, people are suffering, but hopefully with more awareness and more research, that can change and people can get the care that they so desperately need. Tics are just one of many potential symptoms of PANDAS and PANS. It's said that around 70% of PANDAS-PANS patients develop tics. But tics can also be a symptom of other conditions, such as cerebral palsy and Huntington's disease, according to the NHS. Therefore, there are other conditions other than Tourette Syndrome that can cause tics as a symptom. Again, OCD isn't the only symptom of PANDAS-PANS. However, the OCD present can be incredibly severe. But again, as I said, there are many other symptoms, and some people may not even have the typical OCD aspect. It may present as an eating disorder. PANDAS and PANS are real conditions. It isn't something that people just say, well, I'm not going to accept my child has OCD or Tourette's, so I'm going to label them as having this, because people have nothing to gain from that. People are so misunderstood when they have PANDAS or PANS, and there's nothing to gain by people just saying that because they don't want to accept the diagnosis given or something. It's because these people know what it is and they want to get themselves or their child the treatment that they need. There is some of the PANDAS skepticism that I agree with, and what I mean by that is I have a lot of friends in the Tourette community, and the diagnostic criteria for PANS is sudden onset OCD and or food restriction plus other symptoms which can include tics. Now you could say that a lot of people in the Tourette community do come under that. Some people can develop the tics and OCD suddenly when they have Tourette's. However, they may have family members who don't have it as acutely or have family members who have it milder, so it may not be PANS. So yes, there's a lot of overlap and it can be very, very confusing. But all in all, I think that PANS is more underdiagnosed than overdiagnosed. And that's a tragedy because people aren't getting the treatments that they need. And I think that if there's anything that helps at all, why isn't it done? So I think that it's important for people to be aware of the conditions and what it really is. I understand that there's some overlap, but again, it's important to be ruled out because if people have the chance to live a life without debilitating neurological and psychiatric symptoms, then give people that chance. And again, this isn't just about trying to find a way to change people or whatever, it's trying to find a way to help people because PANDAS and PANS really is debilitating, it's horrendous, and I'm just lucky that it doesn't affect me as badly as it does others and that I was able to find treatment that works because penicillin helped me a lot. So I hope that by making this video, it allows people to see what PANDAS and PANS is. PANDAS and PANS is a waking nightmare, so it is my wish that people can be aware of the condition so that people can get the treatment that they need, because people shouldn't have to go abroad for treatment. People shouldn't have to sell their houses to be able to pay for treatment. People shouldn't have to pay thousands of pounds for treatment. These are things that happen, and it's heartbreaking. So much goes on, and it needs to stop. People should be able to get the treatment they need as soon as possible without all of this hassle, because it makes living with such a horrendous condition so much harder than it should be. Thank you for watching. Bye.